Vomiting can be alarming, especially when it happens unexpectedly at home. The first step is to recognize the signs: nausea, retching, and the actual expulsion of stomach contents. Understanding these symptoms helps you respond calmly and effectively. It's important to remember that vomiting is a symptom, not a disease itself. It can be caused by a variety of factors, such as infections, food poisoning, motion sickness, or even stress. By staying observant and composed, you can better assess the situation and decide on the next steps. Let's start by ensuring you know what to look for and how to stay calm in the moment. When someone vomits, your calm presence can make a big difference. Reassure the person that vomiting is often the body's way of getting rid of something harmful. Speak in a soothing tone and avoid showing panic. If the person is a child, offer gentle comfort and let them know you're there to help. Your reassurance can help reduce anxiety, which may in turn ease their discomfort. Remember, your main role is to provide support and keep the environment as stress-free as possible while you prepare to take further action. Safety is your top priority. Make sure the person is sitting up or lying on their side, never flat on their back, to prevent choking. If they are too weak to sit, gently roll them onto their side. This position helps keep the airway clear and reduces the risk of inhaling vomit. If the person is unconscious or semi-conscious, always place them in the recovery position. These simple adjustments can be life-saving and are essential until you can get further medical advice. After vomiting, it's important to clear the area of any vomit to prevent slips, contamination, or unpleasant odors. Use disposable gloves if available, and clean up the mess with paper towels or disposable cloths. Dispose of all materials in a sealed plastic bag. Wash your hands thoroughly with soap and water afterward. Keeping the area clean not only helps with hygiene, but also makes the person feel more comfortable and cared for. Once the immediate mess is cleaned, check the person's breathing. Make sure they are breathing normally and not showing signs of distress. If you notice any difficulty in breathing, persistent coughing, or bluish lips, seek emergency help immediately. Monitoring breathing is crucial, especially for young children, elderly individuals, or those with underlying health conditions. Stay close and keep observing until you are sure they are stable. After vomiting, the person may feel weak or uncomfortable. Offer a cool, damp cloth for their forehead and encourage them to rest. Avoid giving food or drink immediately, as the stomach may still be sensitive. Let them sit or lie in a comfortable position and provide reassurance. Small gestures like these can help them recover from the episode and feel cared for. It's best to wait about 30 minutes after vomiting before offering any fluids. This gives the stomach time to settle. When you do offer fluids, start with small sips of water or an oral rehydration solution. Avoid giving large amounts at once, as this can trigger more vomiting. The goal is to prevent dehydration without overwhelming the stomach. If the person tolerates sips, gradually increase the amount. Do not offer solid foods immediately after vomiting. The digestive system needs time to recover. Introducing food too soon can lead to further nausea or another episode of vomiting. Wait until the person has kept fluids down for several hours before considering bland foods like crackers or toast. This gradual approach helps the stomach adjust and reduces the risk of recurrence. Vomiting can quickly lead to dehydration, especially in children and the elderly. Watch for signs such as dry mouth, sunken eyes, decreased urination, or lethargy. If you notice any of these, it's important to increase fluid intake gradually and seek medical advice if symptoms persist. Staying alert to dehydration helps prevent complications and ensures a safer recovery. Whenever possible, encourage the person to sit up or remain in an upright position. This helps prevent aspiration, where vomit could enter the lungs. If sitting isn't possible, lying on the side is the next best option. Avoid lying flat on the back, as this increases the risk of choking. These simple positioning tips can make a significant difference in safety. If vomiting is ongoing, provide a basin, bucket, or plastic bag for the person to use. This helps contain the mess and makes cleanup easier. Keep the basin within easy reach and empty it promptly after each use. Always wash your hands thoroughly after handling vomit or cleaning up. These steps help maintain hygiene and comfort for everyone involved. Strong odors can trigger further nausea and vomiting. Keep the room well ventilated and avoid using air fresheners, perfumes, or scented cleaning products. Open a window if possible and remove any sources of strong smells from the area. A fresh, neutral environment can help the person feel more comfortable and reduce the risk of another episode. Check if the person has a fever, as this can indicate infection or another underlying issue. Use a thermometer if available, and note any temperature above 100.4 degrees Fahrenheit, 38 degrees Celsius. If a high fever is present, monitor for other symptoms and be prepared to seek medical advice. Keeping track of temperature helps you provide accurate information to healthcare professionals if needed. Observe the color and consistency of the vomit. While most vomit is yellowish or clear, the presence of blood, coffee ground material, or green bile can indicate a more serious problem. Make a note of any unusual appearance, as this information will be helpful for medical professionals. Do not panic, but be ready to share these details if you seek medical advice. Keep track of how often the person vomits and the time of each episode. This record can help medical professionals assess the severity and possible causes. Note any patterns, such as vomiting after eating or drinking, or if it occurs with other symptoms like diarrhea or abdominal pain. Accurate records support better medical advice and care. Do not give over-the-counter anti-nausea or anti-vomiting medications unless specifically advised by a healthcare professional. Some medications can worsen the situation or mask important symptoms. It's safest to wait for medical guidance before administering any drugs, especially in children, pregnant women, or those with chronic illnesses. Encourage the person to rest in a quiet, comfortable environment. Rest helps the body recover and reduces the risk of further vomiting. Dim the lights, minimize noise, and provide a calm atmosphere. Allow the person to sleep if they feel tired, as rest is an important part of the healing process. If the vomiting is due to a contagious illness, take steps to protect others in the household. Encourage frequent hand washing, avoid sharing utensils or towels, and disinfect commonly touched surfaces. Isolate the sick person as much as possible until symptoms improve. These precautions help prevent the spread of infection and keep everyone safer. When cleaning up after vomiting, use disposable gloves, paper towels, and plastic bags. This reduces the risk of spreading germs and makes cleanup easier. Dispose of all used items in a sealed bag and wash your hands thoroughly afterward. Using disposable items is a simple but effective way to maintain hygiene during these situations. If vomiting occurs in bed, change the bedding promptly to maintain comfort and hygiene. Use fresh sheets and pillowcases, and wash soiled items in hot water. This not only helps prevent the spread of germs, but also makes the person feel more comfortable as they recover. Hand hygiene is crucial after any episode of vomiting. Encourage the person and anyone assisting to wash their hands thoroughly with soap and water. This simple step helps prevent the spread of germs and protects everyone in the household from potential illness. While it's important to prevent dehydration, avoid forcing the person to drink if they're still feeling nauseous. Forcing fluids can trigger more vomiting. Instead, offer small sips and let the person decide when they are ready. Patience is key to a safe recovery. Be alert for warning signs that require urgent medical attention. These include severe abdominal pain, persistent vomiting for more than 24 hours, blood in vomit, signs of dehydration, confusion, or difficulty breathing. If any of these occur, seek emergency help right away. Recognizing these signs early can be life-saving. Children are more vulnerable to dehydration and complications from vomiting. Monitor them closely for signs of lethargy, dry mouth, or decreased urination. Offer comfort and fluids as tolerated, and seek medical advice if symptoms persist or worsen. Always err on the side of caution with young children. Elderly individuals may also be at higher risk of dehydration and complications. Watch for confusion, weakness, or signs of dehydration. Provide support and fluids as tolerated, and consult a healthcare professional if there are any concerns. Their recovery may take longer, so patience and close monitoring are essential. Vomiting during pregnancy, especially in the first trimester, is common, but can sometimes become severe. If vomiting is persistent or accompanied by signs of dehydration, seek medical advice promptly. Avoid self-medicating and focus on rest and small sips of fluids. Your healthcare provider can offer safe treatment options if needed. If the person has a chronic illness, such as diabetes, heart disease, or kidney problems, vomiting can have more serious consequences. Monitor their symptoms closely and contact their healthcare provider for guidance. Adjust medications only under medical supervision, and watch for signs of worsening illness. If vomiting is severe, persistent, or accompanied by concerning symptoms like high fever, severe pain, confusion, or blood, call a doctor right away. Early medical intervention can prevent complications and ensure the best outcome. Don't hesitate to seek help if you are unsure. If you need to visit a doctor or emergency room, bring a record of symptoms, frequency of vomiting, and any unusual findings. Pack a change of clothes and necessary personal items. This preparation helps medical staff provide faster and more accurate care. To make cleanup easier, protect surfaces with towels or disposable pads if vomiting is likely to recur. This can help contain messes and reduce stress for both the person and caregiver. Dispose of soiled materials promptly and wash hands after handling. Do not offer drinks containing alcohol or caffeine after vomiting. These can irritate the stomach and worsen dehydration. Stick to water, oral rehydration solutions, or clear broths until the person is fully recovered. Dairy products can be hard to digest after vomiting and may trigger further nausea. Avoid milk, cheese, or yogurt until the person has fully recovered and can tolerate other foods. Focus on bland, easy-to-digest options first. A well-ventilated room can help reduce nausea and make the person feel more comfortable. Open a window or use a fan to circulate air. Avoid stuffy or overheated environments, as these can worsen symptoms. Lying flat on the back increases the risk of choking if vomiting recurs. Always position the person on their side or in a semi-upright position. This simple precaution can prevent serious complications and is especially important for children and the elderly. Have emergency contact numbers easily accessible in case the situation worsens. This includes your local emergency services, poison control, and your family doctor. Quick access to these numbers can save valuable time in an emergency. Once the person can tolerate fluids, offer small amounts frequently. Oral rehydration solutions are ideal, but water, clear broths, or diluted juice can also help. Avoid sugary or carbonated drinks, as these can irritate the stomach. Gradual hydration supports recovery and prevents complications. After several hours without vomiting, you can slowly reintroduce bland foods. Start with crackers, toast, or rice. Avoid spicy, fatty, or rich foods until the person is fully recovered. Gradual reintroduction helps the digestive system adjust and reduces the risk of recurrence. Encourage the person to rest and avoid physical activity until they have fully recovered. Movement can trigger more nausea or vomiting. Rest is essential for the body to heal and regain strength after an episode. Vomiting can be distressing, especially for children or those with anxiety. Offer emotional support by staying calm, providing reassurance, and being present. Sometimes, a comforting word or gentle touch can make a big difference in how the person feels during recovery. After cleaning up vomit, disinfect all surfaces that may have been contaminated. Use a household disinfectant or a bleach solution. Pay special attention to bathroom fixtures, doorknobs, and any shared spaces. Proper disinfection helps prevent the spread of illness. Dispose of all cleaning materials, gloves, and soiled items in a sealed plastic bag. Take the bag outside as soon as possible. This prevents the spread of germs and keeps the home environment safe and clean. The recovery position is a safe way to position someone who is vomiting and cannot sit up. Gently roll the person onto their side with their lower arm in front and upper leg bent at the knee. This keeps the airway open and allows vomit to drain safely. Always monitor breathing and be ready to seek help if needed. Dehydration occurs when the body loses more fluids than it takes in, which can happen quickly during repeated vomiting. It's especially dangerous for children, the elderly, and those with chronic illnesses. Signs include dry mouth, sunken eyes, decreased urination, and lethargy. Preventing dehydration is a key goal when caring for someone who is vomiting at home. Aspiration occurs when vomit enters the lungs instead of being expelled from the mouth. This can lead to serious complications like pneumonia. The risk is highest when a person is lying flat or unconscious. Proper positioning, such as sitting up or using the recovery position, is essential to reduce this risk during vomiting episodes. Responding to vomiting at home requires calm, careful action. Prioritize safety by positioning the person correctly, maintaining hygiene, and monitoring for warning signs. Offer fluids gradually, avoid solid foods at first, and watch for dehydration. Protect others from infection and seek medical advice if symptoms are severe or persistent. With these steps, you can manage vomiting safely at home until professional help is available.